kwa meno, and we don't know what that is about. So that's what we are here to talk about, your area of practice as a dentist. But before we get into that discussion today, I would like you to take this seconds and introduce yourself to the people and they get to know who you are.
All right. Thanks for having me once again. My name is Okoth Onyango. I'm currently attached to the University of Nairobi Dental Hospital. Yes, and a dental surgery. Yes, that's what we do. Yes.
So what are the services that you offer? You know, when we hear dental or kwa meno, most likely I'm going to think about when I have tooth pain or my teeth is going to be extracted.
Well, I think that is, it's a common notion that we get out here. Oftentimes when people hear of dental services, I think it's by the nature of how over the years the practice has been structured in the public domain, so that when people go to, or that when people have issues that regard to their dental health, extraction is what is done. Kama unaumwa na jino unangolewa. Yeah. So most people understand dentistry to be kungolewa meno. I think when we're in school, every time you tell someone I'm studying dental surgery, kungoa meno.
Yeah, most likely that's what we will say.
And that is the public perception out there, which is the wrong perception, but we understand where it comes from. It's because out there oftentimes, sadly, majority of the population understand extraction to be the only way to treat dental problems. But the truth of the matter is that dental surgery or dentistry as a practice covers a larger spectrum other than just an extraction. In fact, a dentist would advise you that an extraction is a very last resort when it comes to addressing a dental issue or a tooth problem. Yeah. So under dentistry, you'll find we have, let me begin the most common one, what you call conservative dentistry. By the term conservative itself, you want to conserve your teeth, you know. So that is where when you come to the clinic, we do an assessment of whatever the issue is. Then we agree on we have a diagnosis. We do, first of all, we check your history, we do examinations, we do investigations, which will involve things like radiographs and all of that. And then we have a definitive diagnosis, and then we have a treatment plan of how we can conserve that tooth, because it is best for you to have all your teeth intact. Yeah. Okay. So that is conservative dentistry. Things like fillings, root canal treatments, all those fall under conservative dentistry. Then we have periodontal dentistry, okay, where we handle gingival issues. The gingiva is the gum, you know, the tissue or the structures that hold your teeth in place. Okay, that is the periodontium, the periodontal ligament and all of that. So the periodontist will help us to address the issues around the gum, you know, things like inflammation. When you brush your tooth, you begin to bleed. That becomes a gingival issue, which is also a specialty under dentistry. Yeah. Okay, we go to prosthetics. Mostly, let me say you've lost, prosthodontics, sorry. You've lost a tooth in an accident. A traumatic event happened and you lost your tooth, and such cases came up. When that happens, you will need a prosthodontist to, you know, either give you a partial denture, okay, or a complete denture, maybe for the elderly who over time have lost all their teeth, but they still require their teeth for normal functioning. So the prosthodontist will give you like the complete denture, for instance.
It's like an artificial tooth.
Yes, it's an artificial teeth. Okay.
It can be one artificial teeth or the entire set.
It can be one. If it's one or two, we call that a partial denture. But if the full set, we call that a complete denture, okay, or a full denture. Then we have the pedodontists. Now pedodontics will involve pediatric dentistry, the dentists who are assigned to children and people with special needs. Okay, those are pediatric dentists. Then now the orthodontics part of it, they deal with things like, let me call it the mechanics of your mouth, okay? Things like tooth alignment. Most of us, maybe you've seen people with braces. That is the work of orthodontics, okay? So they address things like bites, because there is a particular way that we expect your teeth to relate with each other in your mouth, the upper and the lower jaws, okay? So when that relation is compromised, there are effects that come up, okay? So those will help you reverse those effects or to get even just a better smile, okay? Because we're in an age where people are becoming more aware and more sensitive of how they look. Somebody wants to know, how do I look when I smile, yeah? Can you maybe, work on my gum line, can you align my teeth correctly? Yeah. So that is work of orthodontics. So oftentimes pediatric dentists also train in orthodontics because we want to address some of these issues as early in someone's life as possible. So oftentimes you'll hear of the term pedodontist, okay? And on. Now we have like the endodontic surgeons, of which I think in the country we only have 3 endodontic surgeons, having a population of around at least 50 million people. For them, they specialize in root canal treatments. That is all they specialize in. It's a branch of conservative dentistry, but because of the range of issues they cover, it qualifies to be a subspecialty by itself. Yeah. So those are just a few. We have those from dentistry. We still get some public health specialists. We still get health leadership and governance experts
in the dental field.
Yes. So there are very many spaces or other specialties that you can still get within dental surgery. Yeah. So there is the clinical dimension of it, which is mostly appreciated outside there, but there is also the non-clinical aspect of it. Yeah.
It is important. Yeah. Now, just off the book, what is the difference between a dentist and oral hygienist or dental hygienist?
Dental hygienist. Yeah. Well, now some of these terms are used interchangeably in some settings, and in some settings they are completely different. Okay. For instance, in Kenya, we don't hear of dental hygienists. At least I haven't heard of one in this country. What we have in Kenya, we have community oral health workers, the cohos, okay? Let me say, and then you also have the dental nurses, and then we have the dental technicians, all right? Then we have the dental surgeons. The difference fundamentally is, first of all, in the level of training and the nature of training. For instance, let's begin with the nature of training. There are things that only dental surgeons are trained to handle. Okay, for instance, root canal treatments. A community oral health worker is not trained to handle such a treatment. Okay, and part of the reason why most of the public perceives dentistry to be about extractions is because most community oral health workers happen to do extractions a lot. Okay.
And when you say community, which facilities are they mostly assigned to?
So community oral health workers are meant to be like at the very basic level, because in a sense, dental surgery is a specialized, a specialized service. Yeah. You understand? So by the time we get by the time someone is coming to the lowest facility around where they are, if you look at the UHC level scaling of facilities, at the lowest level, you will find a community oral health worker. That is the person when you go to your local dispensary at home or your local facility at home. Yes, you will get the community oral health worker. They are sufficiently trained to handle things at the community level. Okay, then they can now advise, okay, on things like prevention measures. They can run campaigns at the local level, but then they refer up now to the dental surgeons for some things, for some cases. The dental technicians work mostly in the lab. Okay, when we as dental surgeons have, executing a treatment plan, we will, take measurements, do impressions and everything, and then we send them to the lab to be fabricated. For instance, I just mentioned complete dentures. After I've taken the impressions of your mouth and everything, I've seen you're okay, I will send it to the lab. The technicians will work on the instructions I give and deliver it back to me.
So they're the one who are going to mold exactly to the way your teeth will have been.
Exactly, yes. But the instructions need to come from us, indicating we need A, B, C, and D to be done. Yeah. So then the dental nurses, they're just regular nurses, but then they're kind of sub-specialized or there's further training in now nursing for dental care. Yes. So dental hygienists, I think I would say maybe they are the equivalent of the community oral health workers, but now in our setting we don't see them regularly. At least I haven't seen one. Yeah.
So at least there's hope for somebody who's watching this show and they dream of being in the dental field, or they have a child who wants to be in the dental field. There is a wide range of options.
Yeah, there is a wide range of options. I recently was having a conversation with one of my colleagues in school, a senior colleague, and he was telling me, if there's a good time to be a dentist, this is the best time to be a dentist.
What is the reason?
Let me say it's because of the awareness that we are seeing in the population. People are becoming more aware of the implication of oral health care. I'll be honest with you, in the setting I grew up in, back in the village, I never saw a dentist, okay? And a lot of oral health issues, when I go out into the field, sadly, there is still a large perception that dental services or dental care is a preserve for a certain caliber of the community. Okay, it's a luxury, exactly. It's a luxury. Yeah, but over time you are seeing that change, and so the more people become aware of the need to take care of their oral health, maybe for the purposes of health reasons or just aesthetics, then the more we find the need to have trained professionals in that area to address that need. So yeah, the need is growing, the awareness is growing in society, and of course, you know, there is the fulfillment both monetarily and also in terms of just serving the community. Yes.
I will ask that question later, but do you think social media is contributing to the awareness and the need for better oral health? You'll answer that later.
Sawa, no worries.
Let's move on to teeth development, and I want us to take some time here because parents do ask questions a lot about their babies, children's oral health. Yeah. So we're talking about right from birth to maybe up to 2 years, some specific issues, and then 2 years onwards to, let's say, 10 years of age, quite some events happening there. So let's start with the under 2 years of age. So at what point should we expect an infant to have the first teeth?
Let me begin by first of all saying that when it comes to tooth eruption, there is no one size fits all. Okay, that is because tooth eruption is a function of very many other factors, including the most basic one, that is genetics. Okay, and then also when a child is young, there's so much developmental and metabolic processes happening in that body, and such processes tend to be influenced a lot by the environment they are growing up in, and all of these will affect the eventual outcome of such patients, or such children. And also there is also the whole concern about just how the child is handled. Okay, what are they exposed to and everything. So sometimes it becomes difficult to have a one shoe fits all, but what we normally give are just estimates. Okay, so if I was to go into that, let me say within the first, 6 to 9 months, we expect the child to at least have their lower central incisors. Maybe I need to explain that. We have types of teeth in the mouth, okay? Yeah. So we have your incisors, which are what you see when the front teeth. In an adult, there are 4 of them. Yeah. So the 2 central and then the 2 lateral. Okay. After the incisors, we go to the canines, or what in some countries they're called the cuspids.
On the corners, let's call them on the corners.
Yes, they're on the corner of the mouth. When someone smiles, oftentimes you see them sitting somewhere near the corner of the mouth. Yeah. Now the cuspids or the canines. Then you go to the premolars, which oftentimes most like 98% of the children do not have premolars. Okay, they're like the chewing teeth, the first set of the chewing teeth, and then now we go back at the very back to the last 3, which are the molars. Okay, so that is just how that is an outline of permanent dentition. Okay, so both on the upper jaw, that is the maxilla, and on the lower jaw, that is the mandible.
So we can hold there, and then we're going to take a break. When we're back, we will proceed with the same conversation.
That's it.
All right. So we are taking a break, and when we are back, we will continue talking about teeth eruption in infants. So stay around.
You are watching TV 47, the home of untold stories.
Life ni hard, but usitense, jipatie raha na GOTV.
I just want to go home.
Furahia local shows.
Make sure to join us.
Tell your landlord as well.
Dad from Argentina. Event begins 6 p.m. Too late. You are watching TV 47, the home of untold stories.
All right, welcome back. This is the Body Garage, the art of well-being, and we are talking about dental and oral health. I am your host, Dr. Chepsi, and my guest is Dr. Onyango, and he is continuing to explain to us the types of teeth in an adult, right?
Yeah.
And then now you pick from where we left about teeth sprouting.
All right.
Or eruption. Which one is the right word?
I prefer to go with the term eruption.
All right, please proceed.
So yeah, so just to do a quick recap, so we said we have the incisors, centrals and laterals, and then the canines, so the cuspids, the premolars, or the bicuspids, and then the molars. Now, again, as I said initially, that we don't really have like a one shoe fits all determination in terms of age of eruption for various teeth. So I would advise that the surest way to, if you have any concerns, is normally to check with your dentist. Okay, but so what I will give what you call general guidelines that any parent out there may work with. So what normally erupts first in a child is what you call the mandibular central incisors. Okay, the first two teeth on the mandible, that is the lower jaw. Yes, that is between, we expect them anywhere between the age of 6 months to around 9 months. Okay, within that timeline you should have seen that. Okay, the next will come the maxillary. Okay, central incisors. Okay, which will begin anywhere between 9 to 12 months. Okay, and next what will follow are the lateral incisors. Okay, anywhere between again 12 to around 16 months. Then you got the first molars, which will be anywhere between 16 months to around 23 months. Okay, but as I said again, those are very, very general guidelines, because we have seen in practice some who have delayed and some who have actually had them earlier. Okay.
Now let's talk about those ones now.
Yes.
Because parents will ask, my child is 9 months, but I'm not seeing any.
I'm not seeing
any tooth. Yeah.
Yes.
Or my child is just 3 months and I'm already seeing one teeth or two already.
I would even shock you there are those who are born with teeth.
Exactly. Yeah. So those extremes, what happens?
Okay, they're not really extremes. I would call them just normal outliers. Because in most cases, it's nothing to worry about. Okay, it's nothing to worry about. That is why I advise. In fact, what I would say in this scope of the conversation, what I would advise is that parents need to know when to see a dentist, we have a culture of waiting until we see problems before we go seeing a dentist. But I would advise any parent that has a child, at least have your first appointment, at least at around 7 months with a dentist, just for a general checkup. That is when you see things like how the jaws are forming. We can use a radiograph to, to tell, how the teeth are forming inside the jaw, because yes, before you see them, we can see them on a radiograph, how they are forming, okay? So that is what I would advise a parent who's worried, maybe in case I'm on a geno mapema, that is I'm on the teeth are seen earlier, or they have delayed and they're worried what is happening. I think I recently saw a child whose exfoliation, that is what's it called? When the primary teeth are supposed to fall off so that the permanents begin to erupt as well. So there are those children whose primaries will persist for some time, okay? It is not necessarily a cause for alarm, okay? It becomes a cause for alarm if upon consultation with your dentist, you establish a causative factor that is problematic, which could be maybe an anatomical malformation. Maybe the tooth buds just didn't form during development, then we are concerned. Or maybe there's a problem with how the jaws are formed, okay? There is maybe a genetic issue, okay? Because again, we have children whose teeth will form, but they won't form correctly. We have a condition called AI, aminogenesis imperfecta, where yes, we have the teeth, but then the enamel, which is the white that we see in the teeth, is not layered correctly, okay? Or we have children who have dentinogenesis imperfecta. Now the dentin, that is the inner layer after the enamel again, is not well formed. So it is only upon consultation with your dentist that you will be able to pick some of these issues, and then definitive treatment plan is agreed upon. Yes, so I wouldn't advise someone to worry so much, but at least know the guidelines, as I have said, those timelines. That if you're within the timelines, no cause for alarm. But rule of thumb, I would advise at least at around 7-8 months, have your child seen by a dentist. Yes, preferably a pedodontist who specialize in pediatrics and orthodontics. Then they can diagnose so many issues and help guide the development of your child's dentition. Yes.
That is interesting as we move on from that, because for those who sometimes, as you say, they are born with the teeth, a tooth, teeth. They will come and say something like witchcraft.
Yes.
Spiritual, For those who delay that they're the first eruption, the first teeth to erupt, they delay. People ask like, is it because of malnutrition? Like they don't have enough calcium? What can I give the child? Is there a cream I can rub on the gums to make the teeth sprout faster?
Which, those could be issues actually. Like when you mention malnutrition, it actually could be a contributing factor. But you see then, it is not in the place of the parent, who I would assume is largely uninformed about the medical and anatomical implications of factors that attend to growth. So that's what I would advise when such issues arise. Check, are you within the timeline? Fine. If you can wait within the timeline, that is okay. But if you're really, really concerned, which again is okay as a parent, I would advise see a pedodontist soonest possible and have it checked out. Have a conversation with your dentist. Things like neonatal teeth, the ones a child is born with, they're normally addressed right there when you see them. Some can be extracted and some actually just left. Yeah.
Good. So let's move on. You mentioned about the shedding of the permanent teeth, of the primary teeth. Yes. Commonly we call them milk teeth. Yes. And now from the eruption of the permanent teeth, right? At what age should we start seeing that transition?
The transition begins anywhere between 5 to 7 years. Okay? Yes. We begin seeing that transition. And again, they follow that same pattern we had said, okay? Just that now at some point, in this case, now we have premolars coming into play. Yeah, so anywhere between 6 to 7. Actually, we say between 7 to around 12, 14 years, all of them should have should have been exfoliated or should have fallen off, and the primaries began growing in their, and the permanents began growing in their place. Yeah. So as they fall off, you'll just see them. You'll just see the permanents coming up. But then I must mention there is sometimes we've seen cases whereby the primaries fail, but then the permanents cannot wait. They will still erupt. So you find oftentimes someone has like 2 layers of teeth.
Exactly, that's what I wanted to ask you. Like now as we move on, you'll see one is behind, another one is cropping with a very interesting shape and direction. Yes. So should we be worried? And we can see even some adults have such patterns.
When that happens, it's not a cause for alarm. You simply see a dentist and the primaries will be extracted, okay? Because sometimes the primaries will persist, okay? But then now when they persist, you see, one of the things you have to understand about the jaw is a very sensitive part of the body. It's very unforgiving and it's very space sensitive, okay? So when the primaries insist on staying for whatever reason, what will happen is that the permanents will still show up, but they will be misaligned. You'll find some twisted, you'll find some maybe, just not sitting correctly within the sockets. Yeah, so when you realize a persistence of the primaries, you are advised that you see the dentist as early as possible, because if you don't do that, then how the positioning of the teeth of the permanents will be compromised, and that is one of the predisposing factors to a lot of dental problems, including dental caries, okay? Because it will mean you cannot clean them correctly. Yeah, it will mean that your oral anatomy is not well optimized even for function. Yeah, so
might not smile.
Yeah, your smile may be a little bit interesting.
All right, let's talk about some of the bad practices that we do that affect our oral health. Yeah. And then just to mention, for example, what happens to the point we have, I don't know if I'm using the right word, malalignment of the teeth. Yes. One tooth is straight, another one is forward and backwards. Yeah.
Now, there are multiple factors that come into play for misalignment or malalignment to happen. Some are just developmental issues. I mean, maybe the jaw was just small. The people who grow up with a small jaw, but then all the tooth jams are there, or the tooth buds are there. Okay, so by the time the teeth germinate, they find a very small jaw. So they will be so packed, so you'll find they'll be fighting for space. Remember I told you the jaw is very unforgiving. Yeah, so the teeth will be fighting for space. So there are those which are just I would call them anatomical issues. But then there are those practices, even in childhood, that predispose one to misalignment or malocclusion, okay? A very common one is thumb sucking. Okay. Yes. That is why we try to discourage children from doing that. A child who has grown up sucking their thumb of time, you'll find the upper teeth, they grow almost folding outwards.
Okay.
All right. And many other factors again, things like opening bottles using your teeth. Okay. In the developmental phase, your teeth will begin conforming to that habit. We call them para-oral habits, okay? Things like wrong use of toothpicks, for instance, okay? They compromise the integrity of your tooth socket in the long run, you understand? Things like, of course, there is the normal one, a lot of sugar intake without adequate cleaning of your teeth. All of those will predispose you to issues.
What about push, like somebody was saying, like when you constantly push your teeth using your tongue, like you're pushing, yes. Can that affect?
In fact, the effect of that is equal to thumb sucking. Yes, because eventually the teeth will respond to the forces that they are constantly subjected to, okay? So if you regularly do that, eventually your teeth will begin assuming that. Yeah, I mean, it will begin conforming to that force. Yeah, so that happens. So to summarize on that, I would say a lot of issues attend to malocclusion or misalignment, And that is why it's important to work with the periodontist from early in your child's life, that we identify them early enough, that we know, are we dealing with a small jaw here? Some people, their teeth are generally just anatomically, naturally big, okay? So you'll find some people with the very big teeth, the jaw is small. Then others will find the small teeth and the jaw is big. What will happen in that case is that the teeth will have spaces. Okay, we'll have gaps, which again give us so many issues. Sometimes again, you'll find maybe someone has a traumatic event early in life, and so they lost a tooth, okay, from the primary dentition. And so if a space maintainer is not put there to maintain that space again, we begin seeing a compromise in how the jaw develops, because the remaining teeth will want to fill that space, okay? So you begin seeing gaps. And we even see this in adults. If you have a tooth extracted and you don't maybe have an implant or a partial denture put in that place early enough, in the long run you'll begin having gaps in your teeth. Yeah.
Let's take a break and we'll be back. We will pick up from the same conversation. So you're watching The Body Garage, The Art of Wellbeing. When we are back, we continue with bad practices as far as oral health is concerned. Stay around.
TV47, the home of untold stories. Tonight,
we have about close to 10 mass graves. We don't know the contents, but we believe there could be more.
10 more mass graves discovered in Shakahola Forest on a day that 15 autopsies were conducted.
The cause of death, 10 we saw features of starvation, 4 we are unable to see the cause of death, but 1 had head injury.
Government pathologist Johansen Odor says 1 body was found with head injuries. Also tonight, the Kenya Kwanza bipartisan team accuses their counterparts in Azimio la Umoja of being a stumbling block in the ongoing talks.
We also make a plea to our colleagues from the Azimio side. They don't put unnecessary roadblocks on the path.
They insist they are ready for dialogue. Plus, ban on GMO still stands, court rules. Appellate judges Mohamed Warsame, Ali Aroni and John Mativo ruled that the application lacked merit.
You are watching TV47, the home of untold stories.
Welcome to the Mwai Kibaki Convention Center, the premier events venue. Our state-of-the-art facilities are designed to meet all your needs, from large-scale conferences to intimate meetings and everything in between. Located in the heart of Thika, the Mwai Kibaki Convention Center offers stunning views of the city skyline and is easily accessible from all major transportation hubs. Our facility features ample parking, free Wi-Fi, advanced audiovisual equipment, and our technical team is always on hand to ensure your event runs smoothly and seamlessly. Don't take our word for it. Make your next event unforgettable at the Mwai Kibaki Convention Center. Contact us today for bookings and reservations. Email multimedia@mku.ac.ke or call us on 0708 212204 or 0727 441733 or 0721 438 629 to learn more about our services and book your event.
I can't say I sing for a living. I influence for a living.
For the biggest of guests, from politicians to entertainers to content creators to whichever kind of a person you want to think that you'd want to see on the show, this is the place to be. Dr. Funike tonight.
Each and every Wednesday. My name is DJ Lizney, not your ordinary DJ.
And of course, they call me the eagle himself. Your host, Dr. Funike, is my name. Of course, every Wednesday at 7:30. See you there and don't touch.
Make sure to join us.
Tell your landlord as well. Jua unalipia parent.
Sikose.
learning facilities, you literally have the world in your hands in terms of career choice.
The learning is not only uninterrupted, but also supported through ICT. And within no time, you're done with your studies.
Join us and start your career journey.
Intake is in progress. Mount Kenya University, unlocking infinite possibilities.
Mount Kenya.
You are watching TV 47, the home of untold stories.
All right, welcome back. You're watching Body Garage, the Art of Wellbeing, and I'm your host, Dr. Chepsi, and we are continuing the conversation on oral and dental care. And now we are talking about the bad practices that might affect your oral health. So, Dr. You had mentioned about the practices that cause our teeth to be malaligned. Yeah, but there's something about, what about when should parents start brushing their babies' teeth? You know, what brush should they use? How should they do it? And should they use Colgate or just water?
Okay. Now, when it comes to like oral hygiene, there are many ways of achieving oral hygiene, especially for a child. Okay, but let me begin by first of all saying that for a child, it's more of the regular practices that a child is exposed to that affects their oral hygiene. Okay, so what kind of foods are they eating? Are they hydrating correctly? Okay, of course we are saying these for those who already are post-weaning, those who already post-breast milk. Okay, but then now for the children already have their teeth coming up, brushing using a fluoride toothpaste, and let me say also with a soft toothbrush, emphasis a soft toothbrush. There are brushes that I know have very hard bristles, others that have medium hard, medium soft, and others which are just generally soft. For children, I would advise a fluoride toothpaste and a soft toothbrush. Okay, and so brushing again is more of the technique that you use. I usually say cover all surfaces. Okay, cover all surfaces. That's the first principle. You know, that is, if this is your tooth, you're gonna do the outer surface, the inner surface, and what you call the occlusal surface.
Okay. Yes. Let's say upper or lower for the upper.
Yes. Okay. So outside, inside, and upper or lower, depending on the jaw, right? And then in between the interdental spaces, that's where you can do the flossing.
Oh, dental flossing. Okay.
Yes. So you cover all the surfaces and use a fluoride toothpaste. Of course, I know there is a whole debate about is fluoride good for your children or not. I saw some influencers discouraging parents from using fluoride toothpaste, and I disagree with them. We need fluoride to contribute to the development of your teeth. The question is how much fluoride? Okay. How much fluoride? And the good thing, we have the toothpaste that we have recommended by KEBS have passed the test for the required fluoride amount, which you say is around 1 gram per 1 gram per unit. So let me say 1 unit per kilo unit. Yes. Okay, so that's essentially it. So a very soft toothbrush, all surfaces, and then applying, of course, the general rules of brushing, at least for 2 minutes, twice daily. Okay. Yes, at least twice daily. I would advise after breakfast and after dinner. Okay, at least for 2 minutes daily. I mean, for at least for 2 minutes. You understand? Yeah, and then at least I was again at least see your dentist at least twice a year. Okay? Yeah.
That's like every 6 months.
Every 6 months. Go step in for that dental checkup. It'll take less than an hour and you're out of that place. Okay? Step in, we'll check you out. Then that's the time we even call out things before they show up. in your mouth.
More like a prevention.
Yes, more of the prophylactic part of it, okay? In fact, children require more of oral prophylaxis because oftentimes parents don't really see what their children are taking when they're not with them. You're not with your child 24/7, and see the children are naturally explorative. They want to test everything, eat everything, play with everything. So you need that prophylactic dimension as well, okay? So you want to see your dentist at least twice every year. Yeah. Key thing that we forget about oral hygiene: take a lot of water.
Water.
Take a lot of water. Okay. Remember, your oral hygiene isn't just about your teeth. It's about anything in your oral cavity, anything in your mouth, including your lips. Okay. So the more you take water, first of all, the more your saliva production is intact. One of the body's defenses against dental caries or tooth problems generally is the saliva. Okay, so the better the quality of your saliva, the better your oral hygiene. Okay, one of the problems again we see a lot out here is halitosis. You know, foul smell from the mouth.
Breath.
Yes, bad breath. Just water can help alleviate that, because halitosis is one of the things you see is that the mouth is very dry. Yes, so
dry mouth and then bad smell.
Yes, yeah. So we take a lot of water. We advise children from an early age. We encourage them to have a habit of taking a lot of water. Yes.
Will mouthwash help with that?
Now, there's been a whole debate about whether to use mouthwash or not, whether to use it daily or not. And let me just maybe lay a foundation for that debate. One of the things about your oral cavity, we have what is called normal flora. Okay, we have the bacteria or the microbes that are naturally are resident in your mouth, and they contribute to the normal functioning of your body. So the debate is around: will mouthwash kill these normal bacteria and compromise other functions of your body? Well, mouthwash, like any other thing, should be used as advised by your dentist, but the rule of thumb or the general thing is use mouthwash not more than twice daily. Okay, and don't gargle for more than 2 minutes. Okay? Yeah, so after you brushed, you can gargle mouthwash, and not more than 2 minutes, you spit it out and you're good to go. Yes.
Let's move on to what are some of the common dental issues, like diseases or concerns that people present to at the clinic?
I'll begin with the most common one, dental caries. Okay? I want to say what people call it menomiosa. Okay? Yeah, so dental caries, I think, is the most common dental issue we see. And now from dental caries, a lot of other issues can come up. Okay? There's tens of problems that can follow from untreated caries. Okay? So dental caries, how it happens is that the mouth has these sugar deposits that have not been cleaned off, either by not brushing or by poor brushing. Okay? And then the bacteria in the mouth now act on these sugars and produce acid that now begins corroding the tooth surface. And eventually a hole is created that retains food, and then eventually what happens, this hole reaches even the pulp, that is the root of the tooth, and then you begin having pain, and it becomes now an endodontic problem. You understand? So dental care is just one of the problems you have. Of course, you've mentioned malocclusion and misalignment, which could be developmental or due to traumatic issues. Okay. The issue again you mentioned is halitosis, so foul breath, bad smell in the mouth. Okay. Another issue we see again, we have things like sensitivity. Okay. Then gingival issues. That is the issue with the gum. Maybe when you brush, you're bleeding and such.
What about when the gums appear to be
receding?
Receding, yeah.
Yes. Now that is normally like an effect of gingivitis. Okay. Now the gums recede over time. Okay. And how most guys notice this is that the teeth become sensitive and loose. They become shaky in their sockets. Okay. When you come for the examination, normally you will notice the gums have receded. Yeah.
All right. Because of time, we can stop there. But before we go, just for 1 minute, what is the state of dental health services in Kenya? What is the policy around it? What is the government doing about it?
Last year we launched the Kenya Oral Health Policy, that is 2022 to 2030. And while I must laud the progress we have made over the years, there is still much to be done at policy level and also at patient education level or public education level. Okay, as it stands, we have by going by the KDA, the Kenya Dental Association statistics, we have around 800 dentists in practice in Kenya today.
The whole country? For 50 million people?
Yes. So which means there is a lot that is still that is to be desired. Okay, yes. So I would advise that we put more emphasis on training, but again, as with every other health concern, prevention has always been the best measure to take. Okay, so we need to also really do a lot of public education so that we lean our dental or oral health system towards prevention and not just being a reactive system. Yeah. So we are doing well, making progress, but there is still a lot of mileage to be covered. Yeah.
Thank you so much, Dr. Okoth, for your time.
Thanks for having me. Asante sana.
Knowledge and experience with us.
Much appreciated.
All right, we've come to the end of our show today, and so next time when you go to the hospital, when you see the sign dental or okwameno, you will know that it's more than just tooth extraction. And I hope you remember that. My name is Dr. Chepsi. I've been your host. This is the Body Garage, the art of well-being. See you next Thursday.
We value your